I think it's very important to just speak about the fact that the benefit of having these mobile units go to the people is that the Eastern Cape comprises of a lot of rural areas, very dispersed areas, where good health services such as good hospitals, good clinics are in scarcity already. So now this drive by the Minister of Health to take the services to the people is going to allow the young lady in the rural areas, the old lady in the rural areas to have now access to these mobile units. You remember that yesterday 67 units were rolled out by the Minister of Health, Mr. Mkhize, and these units are now going to the various rural areas and municipalities here inside the metro. We are currently, as you can see, I've got my white coat on. We are at Provincial Hospital, which has now got a license to do testing in this vicinity. Now, the good side of that, Blaine, is that people will now have a quicker turnaround time to get the results. You will know that before you had to first wait for 7 days for the test to go to Johannesburg first and then get your results. With this license now, it means that nurses here, the health staff here, are fully equipped to do testing here, have a fully equipped facility to do the testing here, and then get the results within 24 or 48 hours. But right now I've got the Premier, Mr. Oscar Mabuyane, who's joining us this morning. Tell us exactly, so you were inside, you saw for yourself. Are you impressed and are you happy that the facilities is in good standing to do testing in this area?
Very much impressed and quite inspiring. The kind of capability that we have here in this center. And they've actually assured me that they can do more than 1,000 a day. Currently they are working on a 8-hour shift, and if the outbreak comes, we can redouble our effort and have all those double shifts taking place here. So generally, I was quite happy. The pathologist said we are ready. They are ready this side, and it's a question of us getting on the ground. And next week we'll be on a full swing in implementing the massive testing. We're launching it here today. We're here just to monitor and look at all the other issues, teething problems. So generally, I'm quite fine. I'm quite happy. And then the MEC will take it from here, moving forward. And then the team here, everyone is ready.
Yeah, when you speak about this vicinity, what were you impressed by mostly? Do they have the right equipment to do 1,000 tests a day? What about these equipment will help us speed up the testing of people in the Eastern Cape?
They do have those machines. Actually, the latest technology, it's quite amazing. What I've seen there inside, those machines are there, and then they can explain to you much better. But those are machines that we need for such kind of a work that we are going to be embarking on. So we do have this in the province. We do have here in Nelson Mandela that will be able to cover the entire province for now.
Is there a plan to also perhaps go to the rural areas? You know that obviously people in the rural areas also need these facilities to go to them as well. Is there a plan to roll out more mobile units in the rural areas of the Eastern Cape as well?
Yes, of course. We do have, remember, we have these two centers, the Port Elizabeth and the Mthatha one, that have been identified. For now, we're going for the East London one, but the Mthatha one is also being made ready. At any time that the outbreak goes that direction, we've got to activate that one as well. So there are such plans in place. So both centers, both do have pathologists as well.
The Premier key now is to try and encourage people to come to the testing centers. There is a lot of information, especially in terms of the township and the rural areas. So as you now have a testing center, is there a plan to go out first to educate the people, especially in the rural areas, about this pandemic? Because a lot of misconception among our black peoples about this disease. And then also secondly, are you going to also embark on a plan to get people to encourage them to actually come to these centers to come and test?
Yes, of course. That's a gap that we have seen, this massive awareness campaign, at least dealing with basics, getting our people being conscientized and all for them to be conscious about this pandemic. We are also looking in terms of our plan, even if we talk about the massive testing, but we want to target the areas. We've mapped out the areas where we've got positive cases already. So we want to start there. Make it a point that we're dealing with that area, definitely quarantine it in terms of a massive screening and testing at the same time. So we are in that space. We're basically looking at that, but of course we want to contain it already. The national quarantine of this 21 days lockdown helps us to actually fundamentally disrupt the transmission of this virus so that it doesn't move as it moves with people, as people move. So we're basically looking at that, and of course we are calling everyone out there, calling people must come forward. Already we've received such kind of interest and request from responsible people. Those would have been part of these cruise ships and others say, I was in that ship. Where must I go? I was in Cape Town. Where must I go? I needed to go testing and all that. So now that interest is out there and people want to come out and help government, because we've got to stop this. We've got to stop the spread as it actually currently happening. So the massive testing is going to help us. It's going to definitely, remember as a province, we had this influx. Immediately the lockdown was introduced. People were moving all over the country into the province, Johannesburg, Cape Town, in all those areas that already we've got this problem getting out of control. So, of course, we are just delayed here. I can tell you it is out there. It's a matter of time. It's going to actually burst out. So we've got to be prepared. So prevention is better than cure. So we're trying our level best to go out and cut this and make it a point that we are able to encourage people for self-isolation. We have identified areas already. Some of our patients are in self-isolation at home because they are not critical, they are not hospital candidates. So we wanted to look at that whilst people, we can still help them so that they also come forward. But out there, people must be aware. This is a killer disease. It is out there to destroy our human beings. People must be careful. People must look after themselves. People must control themselves. People must help with government to ensure that we effect this 21 lockdown. It's very unfortunate in the province that this week almost disrupted our plans because of the social security grant disbursement. It's a very unfortunate situation, but we've got to recover from it and get our people in their homes. We are looking at establishing street committees because it must not be the work of soldiers and police to ask kids, why are you on street? It must be the work of parents, it must be the work of street committees. So we need this mobilization, this massive mobilization for awareness, and our people must understand it. We have seen it in certain areas where people take responsibility. It's important. We don't want to see people on streets. We don't want to see kids. People must actually keep the social distancing. So we've got to flatten the curve. Even when we're flattening the curve, this will remain there. How are you dealing with that? So it's going to be quite important.
Then, Premier, lastly, you said earlier on that we have about 2,500 places set aside for people once they become positive. Do you think that our healthcare facility is ready to cater to the people once they become positive as well?
Definitely. We are working on that. We are consolidating. We've already identified the quarantine areas. A couple of hotels, facilities that we have in the province are also ready for such a quarantine. And we were in a meeting with Nelson Mandela University. It was interesting, getting them on board, giving us all those options. People are really out there to support. They also have places where we can use for this quarantine period for people who probably might be identified to be positive. So we've got this, and Public Works and Health are working. We do have hospitals that were not optimally utilized. We're activating those hospitals. So we do have this in place region by region. So we're working on the ground, and we are trying to make sure that if it happens, if it goes out, we are able to contain it. We might not really be 100% ready. It depends on the magnitude of the outbreak. But with the plans that we have, we can be able to deal with this kind of situation. But also remember, we need to ensure that the protective clothing is there, and it has been a complaint, and now it is being packaged. That's why we're starting in full swing next week. It is arrived, because we don't want to do massive testing only to realize that we're doing massive infection. So we've got to protect our people in that, protect those who are in the front line of this, particularly the medical personnel. So we have seen it happening elsewhere, that they are also infected in the process. If we can collapse at that, so definitely our systems will be actually disrupted. So we are almost making it a point that the entire system, entire value chain is working, and all our machinery is lubricated.
Premier of the Eastern Cape, Mr. Oscar Mabuyane, saying that he is well confident and sure that our health facilities are fully equipped with the personnel, the technology to deal with the outbreak of the COVID-19 virus. Like I said earlier on, where we are right now is an NHLS lab which has been fully licensed to do testing at this vicinity. He has said the key areas now will be areas where people have already got infected, so they will make sure that they go to those specific areas, encourage people to come and test, and above all, Blaine, like we were speaking earlier on, with the lack of knowledge of the people in the Eastern Cape, they're going to make sure that as they go and invite people, they also inform them about this disease, how to infect it, how to treat it, and also how to go about it once they are infected. But for now, let's go back to you in studio.
Yeah, the Premier was talking about prevention. That's so important. Prevention is so important. Then you don't have to deal with the unknown that is related to this disease. Lerato, as always, thank you very much indeed for your reporting.